Hi, everyone. Welcome to our very first Healthier You Facebook Live event. We're here to celebrate Heart Health Month. We're so excited that you're joining us today. I'm really excited to bring you an all-star guest list here for our very first one. At Oswego Health, we're going to be doing this series regularly to keep you guys up to date on resources right here in our community that can help keep you healthy. I'm Katie Peglaroli. I'm the Corporate Director for Integrated Healthcare, and I'm joined here today by Dr. Thomas Grady, one of our cardiologists, Dr. David Bass, another one of our cardiologists, Kristen Naylor, who's our clinical coordinator for our Center for Wound Healing, and Sherry Krausek from our Lakeside Heart Center. We have some great topics to talk about with you today, and we're really glad that you joined us. I want to thank all of my panelists as well for taking time out of their busy schedules to be here with us today. Dr. Bass, I'm going to start with you. We know that it's Heart Month. In February, we always celebrate Heart Month here at Oswego Health. And heart disease can affect all different populations. Can you talk to us about the effect that heart disease can have on women in particular?
Absolutely, Katie. And that's a very important subject. Women are more likely to present with atypical symptoms of heart disease. What I mean by that is, whereas men are more likely to present with symptoms of chest pressure, that, the classic symptoms we've come to know, symptoms radiate to the arm or the jaw. Women are more likely to present with very atypical symptoms, and it makes it difficult to oftentimes to catch or to make a correct diagnosis in a timely fashion. Women can present with anything ranging from nausea or shortness of breath. I've even seen tooth pain as a manifestation of heart disease. I think it's particularly important to be alarmed at one's symptoms when they're of an exertional nature, meaning if someone has, let's say, nausea that's worse when they climb a flight of stairs or walk a city block a little faster than usual, that's something that you definitely want to consider heart disease for. And this is something that we do tend to see more frequently in women, particularly diabetic women.
Very good. Thank you. That brings us to our next question, which is really a great point, talking about exertion and the impact that it can have specifically for symptoms, but in kind of another way. Dr. Grady, this question is for you. We could not get through any day without talking about the effect the pandemic has had on our lives. And one of the things that we're interested to know is through this pandemic lifestyle, if you will, and I will just say we all know pandemics end and we're rooting for that, but what effect has that had on our health?
Well, particularly someone's mental health, I think, because people are reluctant to go out and be active. We've seen people have gained weight, they're deconditioned, and that's what's a burden on someone's cardiovascular health as well as their mental health and their state of well-being. And with the COVID-19, with any type of viral infection like for influenza, you have an inflammatory reaction modified by cytokines, which are interleukins, that cause inflammation, and inflammation can cause a plaque to become unstable or rupture. And with COVID-19, also there's a hypercoagulable state in our bodies, so that more people are prone to get a blood clot, whether it be in their legs or in their heart arteries. And with a viral infection too, the heart has to work harder because you're fighting off an infection. So you're actually stressing the heart by by increasing someone's cardiac output to combat the virus. I think the mental health is really key, where people just feel, when is it going to end? I think too, there is light at the end of the tunnel now. Whereas before, you kind of walk up a mountain, you didn't see the top of the mountain, but at least now you see the top with the vaccine. And I think with the leadership that we have in place now, I think people are starting to be more optimistic, because before there was little hope, now you have hope. And I think that's really important in someone's overall, not only cardiovascular health, but their mental health too. So I think the toll of the mental health that goes into someone's cardiovascular health. And if you look at the heart, it's like a pump. You have the engine, the fuel lines, and the battery. And the COVID-19 can affect all systems of the heart, whether it be rhythm problems, whether it be a pump problem, whether it be getting blood supply to the heart. So
That's a great way to think of it, and just how our whole body impacts the health of one of our organs as well. So how those two things go together. And we definitely encourage people to find ways to get out and move, even during this pandemic exercise. We'll talk a little bit more about that. Kristen's from our Center for Wound Healing. We had a question. We know that heart conditions can impact different aspects of our health overall. What are some heart conditions can lead to wounds and poor healing? Can you talk to us about that?
Yeah, absolutely. So as Dr. Grady just pointed out, the heart links everything in the body, and wound healing is specifically impacted by the heart. So conditions like high blood pressure, coronary artery disease, venous problems, lack of blood flow, whether it's too much or too little to the legs, can all really impact your overall well-being. Speaking of body parts, your legs are one of the biggest ones to take a hit for people with cardiovascular diseases, because picture your legs like a balloon. You have all of this extra fluid in your body can't process it, and then your legs start to swell. There's only so much movement that water can do, and it starts to make a little tiny hole. These little holes can lead to big wounds. So unfortunately, you're kind of predisposed when you have these cardiac conditions because your heart can't pump this extra fluid. Your vascular system can't move it the way that it needs to, and it leads to these wounds that people just cannot heal. Unfortunately, a vast majority of our population is diabetic, and diabetics are more predisposed to having cardiac conditions. So keeping a really close eye on your legs, is going to be huge for your overall health. We like to tell people, if you notice a little bit of swelling in your legs, it's out of the norm for you. Look at a few things. Did you have too much ham at dinner? Are you eating things that have a lot of sodium? Minor adjustments can fix that swelling. But if you're noticing it consistently, we highly encourage people to contact their primary care to get the ball rolling so we can get them into the cardiac specialties so we can get them on the right medications. We really stress to patients taking the meds that are prescribed by primary care and cardiology to really help with that swelling. But in the instance that they do develop some wounds, we highly recommend coming to the wound care center so we can get that ball rolling too, and get you the services that you need to help heal the wound, to help improve the circulation, whether it's a referral to vascular or to lymphedema or to cardiology to help get you in control again. But wounds have a huge impact on everyday life for patients. Unfortunately, Dr. Grady spoke about mental health. We get patients in here all the time that we act as almost mini therapists for, because they have these wounds that are caused from simple things, but just fixing them is huge, and having the services like cardiology is absolutely wonderful for us to have to help heal those.
Great, thank you. That was very informative for us to hear about, and I think it's going to tie well into our next discussion, which is about Lakeside Heart Center. So here at Oswego Health, we have a place called Lakeside Heart Center. It's a really great place for people who do have heart disease to go and get exercise and monitoring. Sherry, I'm going to ask you to talk about how Lakeside Heart Center can help keep you moving.
Hi, thank you, everybody. Lakeside Heart Center is really a hidden gem in our community. We do a lot with patients who have had all different heart surgeries, cardiac catheterizations, stents, had valves replaced. We get people in who have congestive heart failure. And when they come into us, they're really very anxious, depressed, scared. What can I do? What can I do? Why did this happen to me? So we work with the patients overall. We get a referral from their cardiologist, and they come in. It's bright and cheery here. So when they come in, you really see their face start to light up when they see what it is. Some people have never exercised in their life and are petrified to even get started, let alone after heart surgery. So they come in and we put them at ease. We do, like a general admission, go through health stuff with them. But they notice with people in varying degrees of what part of the program they're in, they're like, they had a heart thing too, and they start talking to each other, and they see, oh my God, I am going to be better. I can do this. So we start them out, on the slow side. Some people that are athletic that really, they struggle with going slower, and some people, that aren't, struggle with just starting. So we go through and we do some classes with teaching besides the exercise. They exercise with a heart monitor on, so they feel a lot more comfortable with that because they know we're watching their heart. There's always 2 registered nurses here watching the monitor, taking vitals, so we do their blood pressure and stuff. And we just keep a very close eye on them and help them. And we notice as they go along, and we tell them this when they first start, you may not notice big things, but when you first start, you may come in and look at the stairs and say, oh, I can't do that, and come up in the elevator. And maybe 8 or 10 sessions in, they're like, oh, I'm going to try the stairs. They get a little short of breath, stop on the landing, come up. And then maybe 15 to 18 sessions in, they come up the stairs and they're like, I came all the way up the stairs and I feel great. I didn't have to stop. I'm not short of breath. So we try to tell them it's those little things that you may not notice every day, but you're going to feel stronger. We're here to build strength, stamina, endurance, get them back to the things that they love to do in life, decrease their depression and anxiety. And it's dramatic, the difference in 36 sessions that we see in the people that we have here. We
That's
also
great.
try to do some diet stuff. It's very hard for people who have for 50, 60, 70 years have, eaten certain foods, certain things, and they're like, I can't stop eating that. So, I really try to find heart healthy recipes and make them at home. Do I like them? Am I going to eat this? And share those with people. But we do a lot of different teaching. We have 10 classes that we teach. They're just short, like 5-minute classes, and just try to, get people comfortable and back to life.
That's great. And Dr. Bass, I see you agreeing with what Sherry's saying. Anything that you have to add about the benefits of cardiac rehab?
Absolutely. And no, that was wonderful. Cardiac rehabilitation is really considered standard of care for patients who have had a heart attack, for patients who have had heart surgery, valve surgery, bypass surgery, for patients who, were recently discharged from a hospital with a congestive heart failure exacerbation. Cardiac rehabilitation is a wonderful, wonderful thing that I think it can make all the difference in a patient's life. It's really supported by professional cardiovascular society guidelines, and it can help people with their symptoms of heart disease. It can improve functionality. It can help people again go back to doing what they love to do, go back to being able to chase their grandkids and just go hiking and just be able to live a better quality life. The psychosocial well-being is crucial, which was mentioned, of course, because think about how traumatic this is for someone to have had a heart attack or to have come out of open heart surgery and stayed in a critical care ward for 3-4 days with tubes and sometimes pumps, etc. And the psychological impact is definitely a profound one that doesn't really get as much attention as it perhaps deserves. But when folks come to a meeting place where they have nurses and caregivers that are there to help them the whole time they're there, and they make friends with other patients who have been in a similar difficult circumstance in their life, and they do this for a few months, it really does make a tremendous difference. And most importantly, it's been scientifically proven to help people live a longer life, which is what the hardest endpoint we could possibly have, which is a mortality benefit. And I think we're really fortunate to be able to provide cardiac rehabilitation here in Oswego, New York, locally for our patients. It's a wonderful thing because it is a very underutilized
Service. I agree. It's a gem. It's a gem right here in Oswego.
Yeah.
And that's why we wanted to get the word out about it. We're talking about improving your lifestyle after you've had a cardiac event. We have a question from one of our listeners. I'm wondering if someone can answer. We want to prevent heart disease. And one of the questions from our listener is, how can we make sure our kids have a healthy heart? And I think in this pandemic world, we all worry about that, right? A lot of inside time. What are some things we can do to make sure our kids have healthy hearts?
Well, I can start off. We need to get kids active. You find as time has gone on, a lot of kids are more into computers and things, and you find them sitting more. So we really need to get them outside. We need to get them back to playing and running and doing those things. We also need to get a better diet. It got so it was so easy with everybody running in different directions, taking one kid to soccer and one to football, that they would go through McDonald's drive-through. So their eating habits are really terrible. So we really need to get back to maybe little snack bags with fresh veggies. It's the best thing that you can have. They got to have some fresh fruit, eat portion sizes. McDonald's has gotten everybody, not to badmouth them, but everybody thinks a portion size is this super size, like the soft drink is like big. We don't need that. You know, we really need to get back to like an 8-ounce glass. Like if you want to have one a day or one a week or whatever. But I mean, I see people drink 3 of those huge, like fountain soft drinks. That's a lot of calories, a lot of sugar. You see people
Absolutely.
just get larger and larger. So good eating habits and getting active.
Great, thank you. Yeah, one more
And
question.
if I may add to that,
Yeah, please do.
if I may add to that question, I think it's also very important to limit soda for kids,
Yeah.
just like was mentioned. Physical activity crucial. You know, avoiding processed foods whenever possible, and something I think is really great is allowing a kid to have an interest in their heart. It's a fascinating organ. They can learn about it on YouTube. They can get children's books about it, and they can learn about how magnificent their heart is and how important it is to maintain a healthy heart.
So maybe that would help them if they don't want to move or they're not wanting to eat healthy. Maybe that would help them get interested in those activities. That's a great point.
It's not an option. Get out there. Go
That's
play.
right. Exactly. Very good. One last question here. Somebody had a question about if they've had a stent and they're placed in their heart, is that permanent? Does that last forever? Or will that eventually dissolve? Will it come out? What is that if they've had a stent?
So, David, do you want to take that one? Do you want me to do it? Or
Dr. Grady,
I'd be
go
happy.
for it.
Sure, go ahead.
so now there are different types of stents. There are bare metal stents, there are drug-eluting stents, and now there are bioabsorbable stents that actually will be absorbed within the endothelial lining or the lining of the heart artery. So what happens is that with the bare metal stent or drug-eluting stent, your own blood vessel lining will coat that stent. It takes about 6 weeks to do that. And during that time, people are at a high risk for having a blood clot form on the stent. But once the stent's deployed, it stays there, it's permanent, but it will be coated by your own blood vessel lining. So it's really important to improve your vascular health by just what was said before through nutrition, fitness, and being like in a state of mind where you're going to be optimistic and have that mental health. And I think the cardiac rehab really addresses all those needs. That's why it's so important when someone has a stent deployed that they do participate in the cardiac. And I don't like the term rehab. It should be a cardiac fitness program. So we could change the name to a Oswego cardiac fitness program. I'd be advocating for that. Now, the bioabsorbable stents, I don't think they're approved right now in the United States by the FDA, but they are in Europe. And these are stents that will be absorbed within the endothelium of the lining of the heart arteries. And that takes, again, about 6 weeks to 12 weeks to do. And so they're going through clinical trials right now. But as is right now, the stents are permanent. They can't be removed unless they're removed surgically. But your own blood vessel lining will coat that stent.
Thank you. That was great. I wanted to thank everyone for joining us today. I'm really impressed by the level of care that you guys provide to our community. You got to learn today about the great cardiology program we have here, our Center for Wound Healing, Lakeside Heart Center. I like it, Dr. Grady. We can call it Lakeside Heart Center. It doesn't have to be rehab. It could just be about heart health. We need you to move more, eat well, come see us. We're right here for you. Quality care right at home. Thanks for joining us. Next month, we're going to be back with information about colon health. So we hope that we'll see you then. Bye.
Bye now.
Thank you.